The streets of Stockholm don't look all that different from how they did before the pandemic started. As countries around the world are trying to flatten the curve through lockdowns, Sweden has gone in the opposite direction, avoiding drastic restrictions on public life. Social distancing is recommended, but with schools and businesses still open, the government is reporting thousands more coronavirus cases and more deaths than neighboring countries.
We trust the system in a way that I think more other countries maybe don't as strongly, so maybe that also plays a part in why Sweden doesn't feel that it's necessary to put such forceful measures at this point until the case worsens.
Sweden is prioritizing herd immunity, a strategy that was considered by other countries but abandoned because it would overload healthcare systems.
Man ska inte gå till jobbet när man är sjuk, och man ska absolut inte nu av flera olika skäl besöka sina äldre anhöriga.
Dr. Anders Tegnell is the country's chief epidemiologist and the architect of its coronavirus plan.
I think all countries, all epidemiologists you talk to will agree that herd immunity is the one thing that will eventually slow down the spread of this virus. Nothing else will slow it down in the long term. Either you reach it by people getting infected and getting well again, or you reach it by vaccinating people, and the vaccine is so far off. Most countries are trying to do the same thing. We're all trying to slow down this epidemic as much as possible, so our healthcare and social welfare and the whole system keeps on working. We do it by slightly different methods, and that means that in Sweden we have used a lot more voluntary means than in other countries, because that's the way we usually work.
But Sweden's scientific community disagrees with Tegnell's strategy. Last week, more than 2,000 doctors, professors, and researchers signed a petition urging the government to introduce more aggressive lockdown measures.
I think that is a tradition here in Sweden that we should trust the authorities, we should trust their experts. But I'm a scientist and I don't trust authorities, I trust data.
Dr. Cecilia Soderberg-Nosler believes that prioritizing herd immunity is dangerous and can't be justified.
The problem with herd immunity is that we don't have any data on this yet. And I think that we shouldn't be the first ones to test it. It's an experiment that I didn't give my informed consent to, and many with me have not done that. The data that we at least have access to and the development that we've seen in different countries just say that, no, this is not a path that is safe to take. Nothing is safe here because many people are going to suffer.
People are already suffering. The death rate in Sweden is accelerating faster than other Scandinavian countries. And even with efforts to keep businesses open, the economy is still predicted to shrink by up to 8% this year. Dr. Tegnell still defends his plan.
I think there is no data that anybody uses that can say anything about the evidence of any method we're using today. We are in completely new territory, all of us. So we're actually following the development, and we are looking at how well this social distancing works, and so far it seems to work reasonably well.
Social distancing is more relaxed in Sweden. Much of Europe has gone into lockdown in the face of the coronavirus's relentless spread. But in the spring sunshine, Stockholm's cafes have customers, the schools are open, and the Prime Minister has urged people not to panic.
We hope that they are doing the right thing. I think that, you know, we Swedes normally we are better at social distancing in the first place. So it just feels that we are continuing living the way that we normally do as well.
It's about saving the restaurants. It's about saving the pubs. It's about saving people's work. Maybe we have found a good balance, but let's see when it's over.
The elderly have been told to avoid social contact. Crowds of more than 50 banned, but otherwise people are largely free to go about their normal lives.
This is how life might have been in Britain too, but then came that computer simulation by Imperial College London that showed that hospitals were about to be overwhelmed, 250,000 people could die, and the country locked down. But here in Sweden, the authorities just don't believe that research.
The doctor in charge of the strategy has been charting the upward curve in deaths, but he insists the simulation was based on assumptions and poor data.
I mean, compared to us, it's hugely pessimistic. And I don't think any curve in any country has gone that bad as the Imperial College says it's going to be. And I don't think there is no real connection between having a lot of lockdowns, closing borders, closing schools and so on, and being safer.
Some scientists are horrified by the risk they believe the authorities are taking. Many lives could be lost.
I'm a scientist. I don't trust authorities. I trust data, and I don't see transparency of data that makes me calm to say that the strategy chosen is the best way forward.
But they might be right.
They might be right, and I will open a champagne bottle then. Because this is not about me and who's right or wrong. I think that we should have an open discussion about the scientific data.
The authorities are building a field hospital just in case.
So this is one of the wards then?
That's correct. This is one of possible 60 wards. In every ward it will be 10 beds.
The first patients are expected as soon as Monday.
You work with Medicine Sans Frontières, Doctors Without Borders. Yeah. Did you ever imagine you'd be building a hospital like this in your home country?
Never, but I'm sure nobody anticipated what we're seeing now in all levels of society.
Sweden is hoping to let the virus spread slowly, an aim Britain once shared. Now the UK is trying to completely shut it down. There's no way of knowing which strategy will save more lives in the long run. Thomas Moore, Sky News, Stockholm.
At some point, there's a tipping point. At some point, we actually need to say, this is enough. If we go further, we're actually going to damage the economy more than the few extra people we're going to save. This makes people feel very, very uncomfortable because you feel like we should save everyone, but we never do. In a society, we always make trade-offs.
So global warming is real, and it's a problem.
Danish political scientist Dr. Bjorn Lomborg is a globally recognised economist and big thinker who's turned his expertise to the coronavirus conundrum.
You know, in Australia, the speed limit is 110 kilometers an hour. If you want to save everyone who dies in traffic, you should just take it down to 5 kilometers an hour. Nobody would die. But of course, the point is you don't want to do that because it also has huge social ramifications. We should do a lot for corona, but we shouldn't do everything. Just like we should have speed limits, but we shouldn't have speed limits down to 5 kilometers an hour.
Dr. Lomborg reckons going too hard on lockdown is a strategy that will come back to bite us in the long run. The middle ground, he believes, means opening society up and accepting more coronavirus deaths in the short term.
When you close down primary and secondary schools, when you close down jobs, are you actually creating more damage, more long-term death, more long-term unemployment and unpleasantness for the whole population compared to what you're achieving in saved lives?
I mean, we in Australia are just taking the policy decisions on the chin so far. But that's it, isn't it? How far do we go? And how do we sensitively strike that balance between saving lives and crippling the entire economy?
So I think a lot of people want to do a lot of good for the coronavirus. And so they're willing to say, look, I'm going to take it on the chin, as you say. But ask yourself this. Do you think the same people, when they finally get out from this lockdown and see the devastation of their economies, then being asked when the second wave comes around and say, I'm sorry, could you do it all over again? And then a third time. Remember, we'll have to keep open, close, open, close, open, close, all the way till we get a vaccine. And so we need to ask ourselves, how much is too much? It's not clear what that answer is, but we need to have that conversation.
In Sweden, they've taken a different approach to the rest of the developed world in tackling the nightmare of COVID-19. The streets are busy, businesses are operating, restaurants and bars are open, and primary school kids still go to classes.
We haven't shut down the whole society. If authorities would recommend that, we can make that decision. But it's even better if we can get normal people to actually act sensible and use common sense to actually have a society working long term.
Home Affairs Minister Michael Damberg is helping oversee this typically Swedish approach to the crisis. Here, social distancing is suggested, not enforced. Only the elderly and the vulnerable are in lockdown. For the rest, it's life pretty much as normal.
If we don't have a society that works, then the healthcare system cannot work. So you have to strike the right balance here. And if it doesn't work, we're ready to make new decisions.
It's a high-stakes move toward herd immunity, to slowly spread the virus through the healthy population. The country's death rate per capita is already higher than that of the US. If it all backfires, the cost in lives could be immense. One of your newspapers described the way you're doing this, your model, as playing chess against death.
I think all countries are playing chess with a new pandemic that we haven't seen before. But so far, the healthcare system copes. It is a strain. It is a very difficult situation. But so far, the system has worked in Sweden.
Whether or not the Swedish experiment continues to work remains to be seen. But political scientist Bjorn Lomborg sees it as an example of the terrible trade-off we all need to make.
If you are successful in reducing the death rate now, what you're simply doing is you're going to see a higher death rate later on. I think that is actually what the Swedish authorities are doing right now. They are accepting to have more deaths right now because it'll also mean fewer deaths in the future. And at the same time, of course, it'll mean less economic damage.
It's a very grim cost-benefit analysis, isn't it? Perhaps the ultimate one.
It is. It totally is.
Hello, I'm Sarah Arbo. Thanks for watching. To keep up with the latest from 60 Minutes Australia, make sure you subscribe to our channel. You can also download the 9Now app for full episodes and other exclusive 60 Minutes content.